Hey guys, Dr. Chad here today with another in my series of alternative options to anxiety. Today we're going to do one that all of us know about, which is CBD oil. This really entered mainstream society a couple of years ago, and I think every single person at some point has tried it or knows someone who has, and I think all of us, myself included, get confused as to what it is, what it does, what dose to take, and so forth. So I did some research. I pulled 6 studies total, but to be honest, I looked at more than these 6 studies. First, just for an education standpoint, when you hear CBD, we always think of marijuana. Marijuana cannabis plants have actually 80 active ingredients. THC, which is the one that gets you high, is the one we know some more about. CBD is another one of those 80. The hemp plant actually has much higher CBD than THC. For a hemp plant to be legal, they have to have less than 0.3 THC. So when you're buying CBD oil, a lot of these products have a very low concentration of THC. This is very important because sometimes if you take a certain CBD oil, some of those products can have enough THC that a urine drug screen can show up positive. So it's very important to note that. When looking at the studies, very similar to a lot of these other studies I've looked at, they're all over the place. There are case reports, there's some animal models, but it's really hard for me to decipher looking at the study exactly what to recommend. The dosaging in the studies went from 6 milligrams to 1,500 milligrams. So you're talking about a huge range. The other problem with these studies is they all use different products. And a lot of these studies talk about when you're dealing with a dietary supplement, you never know exactly what the purity is in what you're buying. So if you're going to try CBD oil, you need to make sure you know where you're buying it from, who's the grower, the purity, and so forth. My take from it is that there's some decent evidence that it works well for anxiety, not so much for sleep, but there's a couple really good studies looking at people doing public speaking, other type of anxiety-provoking events where the CBD oil made a big difference. What's really good about it is no study, even the animal models, showed any side effects. So it looks to be very safe. Again, the studies went up to about 1,500 milligrams, so above that I can't speak to it, but the studies show that it's really safe. There was one interesting study doing SPECT scans and blood flow in the brain, and showed that with CBD oil, it actually increased some areas of the brain called the limbic system, which would be associated with anxiety. So again, some good evidence that this stuff works. So again, my overall take from it, I think it's mainstream in our society, probably a little more fluff than reality. Why that is, I think it being tied to THC and marijuana probably gave it a little more of a push than maybe what the literature supports. But I certainly have no problems with anyone trying this for anxiety. Based on the literature, I would say around 400, 600 milligrams a day. But again, it's hard for me to say what that means because it depends on how pure the source is, where you're getting it from, and so forth. But again, huge disclaimer, before you try this stuff, make sure you know for a fact the amount of THC that's in it. A lot of my friends at home are working oil fields, and certainly you don't want to get a positive drug screen taking a supplement because you didn't know what was in it. So I hope this is helpful, and stay tuned. We'll have some more information on some other supplements. Take care, guys.